The commercial opens, and a beautiful woman appears holding her young infant. The lighthearted background music gives no indication of the severity of this commercial's topic, and then the mother shocks audiences with her horrific confession that sometimes the most dangerous place for your baby is in your arms. What silent killer could this mother be referring to? The answer, a disease caused by a bacterial species known as Bordetella pertussis, is pertussis, commonly known as whooping cough. Whooping cough has long plagued the human population, tracing back to the 16th century. It was considered a common childhood disease that caused high rates of mortality in the United States. In fact, in the 20th century, there were more than 200,000 cases reported prior to the creation of a vaccine. So how does Bordetella pertussis actually cause this painful disease? To start, once the bacteria have found a host subject, they produce a specific adherence factor that is used to attach themselves to the cilia of respiratory epithelial cells. Next, the bacteria produces an exotoxin that paralyzes the cilia and causes inflammation of the respiratory tract. This disrupts clearing of pulmonary secretions, leading to the development of a dry, painful cough.
In the first 7 to 10 days after infection, the patient exhibits symptoms common of the average cold. However, as the cough becomes progressively worse, patients reach what physicians describe as paroxysmal stage. During this state, as the patient attempts to cough, the increasingly blocked airway causes the cough to sound literally like a whoop, giving pertussis its common name of whooping cough. Death is rare, but most who die from this disease are infants. The decreased lung capacity cannot handle the intensity of the cough, and infants with whooping cough must be monitored at all times for fear that they could stop breathing during the cough spasm. Due to the creation of the vaccine, whooping cough cases have decreased significantly by 80%. To this day, it is common to receive DTP, DTaP, and Tdap, which are different formulations of the combined vaccine protecting against diphtheria, tetanus, and pertussis. However, in recent studies by the National Notifiable Diseases Surveillance System, in 2012, 48,277 cases of pertussis were reported, the most in over 60 years. While it may just be a cough for you, pertussis can have life-altering effects for the families of young children and infants who contract this disease. Go out and schedule a pertussis vaccination today for you and your loved ones. Let's help keep a mother's arm the safest place for her baby.